So, questions from the floor. Final push of energy. Yes, please, at the back. Thank you.
Hi, I've got a question for you, Cara, about A&Es. So I work at UCLH, and we've got quite a busy A&E, and we tried to explore this, and it sort of ping-ponged around between, no, the local authority needs to be responsible for these sorts of things, to, no, the ambulance service needs to pay for it, to, oh, we probably aren't going to pay for it, to, there isn't infrastructure to pay for this. So I guess my question is it dependent on there being things like charging points, A&Es? And if they are, who's going to be funding that? Would it be split between provider and ambulance service?
So I'm quite keen on sustainability not being the driver for everything. I think it's a good thing to have in the background, but actually what we have to do is fit sustainability into the operational model and make sure that it underpins how we deliver our care. And so I think all of the things that you've said there, where we have charges outside A&E or where we just have charges on stations, are theoretically possible. They probably just mean we spend money in different pots. And really, it's all the same pot of money that funds the NHS. It's just different places get different parts of that pot at different times. So we could spend loads of money expanding the electric infrastructure at ambulance stations to put in the really quick charges that we need to charge an electric ambulance outside an ambulance station. But actually, if we don't need to spend that money to do it outside of a hospital, maybe that makes more sense. In terms of who pays, I think the conversations I've had so far with NHS trusts that have A&Es is maybe that's something that we work out and negotiate together. I think there's not a steer on that from NHS England at the moment, so it's all a bit softly, nicely. Let's see who has some money to pay for it. But I certainly know that we're keen to kind of work with people at EMAS and aware that comes with a cost.
Thank you.
I think we've got two final questions. So yes, there, please. And there's one down there as well. Thank you. Please, your question.
Hi, my name's Luke Champion. I'm the Sustainability Manager at Avon and Wiltshire Mental Health Trust. And just a general sort of question, really, to the panel, and sort of kind of a thought I've had today. We've heard a lot of really good innovations about how to get to net zero and all the ideas, and it's been really good. I've really liked it. I suppose my thought really at the moment is, given the huge cost that it would entail for our trust, just as we've done some calculations and we've worked out to get to decarbonise our heating systems in our sites that we've got control over, would cost at least £57 million. That's a conservative estimate. Where does the panel see, or what ideas do you have on thoughts of where that funding might come from? As an example, do we see it more public-private partnerships happening in the public sector to drive that funding, or do we see a change in government policy? Because it's a big question in the room that I often get asked as a sustainability manager. Will we get to net zero by 2030, which is our target? And my answer is yes, if we have the finance or resources, because we've got the will, we just don't have that. And I just wonder if anyone has any interesting ideas on how that might be possible.
Who'd like to take that, Cara?
Yeah. I mean, it's quite literally the multi-million-dollar question on how you fund this, and I think it's one of those that we have to look at all the options. So I'm sure, Luke, you've had experience with Salix and the joys and challenge that comes with that, and there are certainly opportunities to do things more innovatively, working with industry. I also think one of the themes that has come out really strongly today is that actually reaching net zero is the best option for service users and for patients and for the health of the population in terms of prevention. And there are local air quality benefits of moving away from gas-fired boilers. And so maybe we need to start thinking about how to look at that wider piece and say, actually, whilst this does cost 23 million, it will save X amount of money from the respiratory care practices that you may need to deliver, or it will keep more staff in work because they are working in a system where the heating is managed well. And I think that's a real challenge in how you do that, but maybe there is more scope to find some funds that way.
That sounds like a wise first step. So please, we've got a question there.
It's not really a question, actually. It's a follow-up to that question,
Okay, great.
really. And I've been here all day and listened to the presentation. It's been fantastic. Thank you. But funding always seems to be the biggest elephant in the room. And it's really about what I've learned to do over the last year. So I'm actually a finance broker. And a trust near me actually tasked me because they didn't get the PSDS grant. They had previously in the past, but didn't have enough time to put all the implementations what they wanted to do. So they tasked me for a solution on how they can do that, with IFRS 16 being a problem with operating leases and whatnot. And actually, we're working on a solution that will be able to decarbonise their hospital or look at certain levels of decarbonisation. And it's something called asset as a solution, asset as a service, where an investor or a funder will actually purchase the equipment what you need and put a meterage on there, or maybe a charge per patient or per hour or per kilowatt for energy services. And actually, if you don't use that service for the month, there's no charge for it, so all the risk is for the investor and not for the NHS Trust. Is that something what a solution what moving forward be something what people want to talk about?
I mean, I think, all ideas are always welcome, whether people would go for that, I guess, with previous financing instruments like PFI and other things, people might be slightly nervous. But, I mean, I think we need all the ideas that we can get to have a look at, explore all the opportunities. So thank you for offering that. It sounds like an imaginative solution. So I think that leaves me to thank our panellists for their brilliant contributions in their talks, to thank all of you for coming. I think to really appreciate what a fantastic, I think we really need to close, I'm so sorry. What a fantastic day we've had. We've learned so much from inspirational leaders. We've heard about how we need to change mindset. We know that we need to make it super practical. We know that there is lots of support out there to really drive forward that innovation, to help you with your thinking, to help you if you're a clinician to make change happen. We heard about how you can green your supplies. We heard this afternoon about all the tools and techniques that you can use. And we've just heard some really practical examples of how you can make change happen and the ways in which people are innovating. So for me, it's been a fantastic day. I've learned a huge amount. I hope you've enjoyed it, only as even more than I have. And thank you also all for all your active contributions and for all your questions. And I hope you also enjoyed our breaks. Finally, just want to thank GovConnect for making it happen, and for Snyder Electric for their support in probably providing our lunch, amongst other things. So thanks to all of you for coming, and safe journey home, and look forward to seeing you next time when we discuss our favourite subject of sustainable healthcare. Thank you very much.